I'm so honored today to have an amazing nurse entrepreneur, Tiffany Gibson. Tiffany, how are you today?
I'm doing well. I'm actually in a really good mood today. Thanks for asking.
Oh, that's awesome. Let's talk a little bit about technology, AI, artificial intelligence. That's the big buzzword in healthcare. Big thing for organizations right now. They're looking at artificial intelligence to maybe look for clinical
Hmm.
opportunities to reach patients. We don't believe in that. We believe maybe it can help with personalization. So could you make it more personalized communication channels to engage
Hmm.
patients, but not clinical decision making? We don't think that's
Hmm.
relevant just yet because there's just too many issues with AI. As a nurse, when you're hearing about AI and how it's going to potentially take your job, and do what you do,
So,
yeah, exactly. I would be curious, what are you hearing at the higher levels? And do you see the usefulness of AI and what you think it can or can't do for nurses as they kind of navigate this?
one, I want to say, I think it's funny how everyone is concerned about AI when AI has been around for a while. If you've ever interfaced with any company online and saw that chat feature at the bottom of the screen, that was AI. If you've ever called a automated service line and you had to speak your answer and it kind of put you into an algorithm to determine what response to give to you, that was AI. So AI has been around for a while. It being in healthcare the way it is now is fairly new and novel, but it's been around for a while and it's been successful in other industries. And so I am not afraid that AI is taking my job because it cannot think like a human, right? We still need people to manage and run the AI, but what I think it can do is cut down time. I am a fan of ChatGPT. And what AI looks like for me in my world is creating smart sets where instead of me writing out a whole letter, I can say, create a message for this patient regarding a conversation we talked about, and send the email and have it summarize it. That just saved me 10 minutes of my time. Thank you so much. I can go ahead and use that 10 minutes for someplace else. I think AI is very much a tool for efficiency. It's not a tool for replacement. And so if we know how to maximize and use it properly, we can be more productive or, have more efficiency and maybe decompress some of the role, the task of the nurse because we're using it for standard ordering or we're using it for smart set communication or adaptive communication and streamlining ways that we operate. I think AI can help with that. Nothing to be afraid of, but people don't like change and people don't like the unknown. And if they're unable to fully conceptualize something, there's a little bit of fear in that.
Oh, yeah. Yeah. I have a background in engineering. The AI used to be called machine learning, algorithms. To your point, Facebook, every time you open Facebook and it recommended a friend or some ad to you, that was AI. So we've always been around AI. It's just ChatGPT exploded because it was a
Hmm.
new interface to
Hmm.
AI that we never experienced before, right? And so that's how I kind of looked at it. But also for healthcare, I think that people have to think of it as like a really smart intern. It doesn't know everything you know when it comes to the functionality of your job and really the value what you bring to the job. But it can do things like you said, help you get things done faster, can automate certain tasks, but also it can even help with research or even get you started with care plans and do different things that you may take you a while to kind of set up, but it can at least get you started and you can take it to
Yeah.
the last. Because really, let's be honest, 80% is the 80-20 rule. So 80% of something is just
Hmm.
the setting up, getting all ready. That last 20% makes all the difference. And that's where you bring your
Hmm.
uniqueness, your expertise. And that's where AI can kind of help you get to the 80% and you focus that time on that 20% that's going to give you the maximum value for that project. So to your point, it's not to be afraid of, but it's something to be aware of and
Yeah.
hoping all nurses and healthcare organizations start to, utilize it and not be afraid of it and kind of move it forward. Speaking of moving forward, I mean, you're doing some innovative things, not just with building your business, but also in social media. And that was a big thing. We're seeing a lot of nurse influencers, doctor influencers out there in social media. Why is that important to building your brand as a nurse or just a healthcare professional in this new age of social media and speaking the value that you can bring to the audience? What does that mean for you and why do it now? What's the
Mhm.
goal? How should nurses think about about it?
I want to start with the disclaimer that I don't see myself as an influencer. I see myself as an educator. The word influencer has so many different nuances that it sometimes makes me cringe because that is a job. Influencing is a job on social media. And to me, this is not a job. This is just my passion and my life's work. I was born to be an educator, period. Nursing is not my first degree. I've always been educating. I've always had a knack for taking complex topics and making them consumable for the end user. Whether or not I was at the bedside and I was a nurse and I was basically helping parents understand what the provider was saying, because people would say, yes, of course. And then a doctor leaves and they're like, what? So I've always had that knack of just kind of translating complicated things and just making it relatable. So I'm an educator and I like to talk. And so public speaking is never an issue for me. Instagram was the perfect platform for me. I can share my 2 cents, I can be radical, and it takes 20 seconds and then I'm off doing something else. However, I do think, one, just having a personal brand outside of working, outside of the profession, is just good for a person, period. It just helps you with understanding what is your mission and vision in life. And not necessarily saying you're running yourself like a corporation, but having some standards, having a goal, having something to work forward to, having metrics for yourself, and saying, this is who I am, so that when someone asks you, tell me about yourself, you're not listing off titles and tasks. I'm a mom, I'm a nurse, I'm a this, I'm a that. Like, those are titles and tasks. It doesn't tell me who you are at all. I guarantee you, 9 out of 10 people, if you ask them to introduce themselves or tell you about themselves, they're going to rattle off a list of how they serve other people. But that still does not tell me who you are. And so having a personal brand lets people know who you are. And when you go to my social media, you have a sense of Tiff. I am a nurse. I'm in nursing leadership, right? And I do nursing differently. Yes. I also like to have a lot of fun. And I'm very much abrupt and I speak my mind and there's no qualms about it. And then I also have this very much spiritual, out of this world, universal, divine part to me that I share as well. And you can tell that from my Instagram, from my social media. Now, all of my social media platforms look different because there's different audiences on those platforms. So LinkedIn Tiff doesn't look the same as Instagram Tiff, doesn't look the same as TikTok Tiff. And that's on purpose because those platforms are different and you want to maximize the differences. But the brand is all the same. What you see is what you get. And if you meet me in person, it's the same. It's not a persona. I think, one, nurses have an identity outside of their title and their profession. I'm Tiff. I'm not just a nurse. But there's a lot of nurses who are super proud of their degree and their profession. And so on social media, that's what they lead with because they're very proud of it. But I don't want them to forget that behind the degree and the credentials and the title, they are a human, they're a person, and there's a lot more to them than them showing up for work and taking care of others. Having that personal brand or having a brand period just shows people your mission and your promise. And that's what it is. Why is this needed now? Because social media technically is still fairly new in the grand scheme of things. There's still lots of different platforms that are still popping up and gaining traction. It's a way to communicate in this day and age. And so when you have that presence and you're connecting with others, and nursing has a big community on social media, your brand just shows your mission, how you show up in the world, and your promise.
Now, I will say there's this story about the digital natives and versus folks that didn't come this honestly. Like I grew up, there was no internet, right? And so this is new. But then there's folks like my brother and sister who are like 12 years younger than me. They grew up with this. My kids, this is all they know. And so I think, social media is a new way of communicating. And it's just like anything, any tool. TV was new at one time. Radio was new. You have to learn the medium, right? The more you get on social media and build your presence. And I like what you said, you bring your full self to it. Then guess what? You attract the people that like you, get to know, like, and then eventually trust you. And you'll be
Yes.
amazed at what doors opened up. I'm sure you can count countless times. For instance, this is how we connected on social media. Countless times that you'll find new opportunities that are just on the other side of you being your authentic self and being consistent out there on social media. And so building that brand is really just associations. And then, you know, I'm looking at your background, see you're a Delta. You see, I went to FAMU, Florida A&M. So those are things that we're bringing to the table, even as we're still in a professional environment. But then people who are associated with those type of things, oh, I like her because she's a Delta, or I like him because he went to FAMU. And I think, you know, that's so key, that you have to build that presence out there, especially in this new era, because that's the new way of communicating, and that's the new way you're going to find new opportunities. We highly encourage all of our nurses to be out there on social media and build their brand as well as others, because it's just a new way of communicating. But more importantly, I think even doctors, they want to admit it. Yes, they do research on and find things on social media and connect with folks that way. Yeah, we're highly big pushers for like communicating and being out there on social media and building that brand, especially in healthcare, because there's just so much information out there, and just having the right people you trust and building that trust with your community is going to be even more important for the future, right? So I commend you for, you know, being out there. Wow, this is amazing. Tiffany, this has been a great conversation. I mean, where can people find you and get your resources that can help them?
Well, you can find me on LinkedIn sharing my 2 cents at Tiffany E. Gibson. I am on Instagram and Facebook and TikTok. I think I'm still on X. I'm not sure. At New Nurse Academy, or you can just type in Tiffany Gibson and finds me. I enjoy connecting with the masses. I enjoy the community that social media brings. There, as humans, we are social beings. We like community. We like to find our tribe and to build and grow and learn with our tribe. One thing I don't like about social media is the commiseration, and I see that often in the nursing world. To me, I'm always trying to find a solution. If I'm not part of the solution, then I'm part of the problem. And if I'm silent, then sometimes that means you're complicit if you're not saying anything. And so social media has amazing pros in that you can reach a lot of people just by using your phone. And so in my little corner of the internet, I want to just show nurses how to just show up differently at work and in life, and to be authentic. And that's the new nurse mindset for New Nurse Academy.
Hey everyone, welcome to Medical Practice Success Secrets. I'm Theo Harvey, the CEO of SensorMed. We're a remote care monitoring company that helps healthcare organizations. And I'm super excited to have a guest. We're going to talk about rural healthcare and its importance and how it's shaping the future of healthcare. So I'd like to introduce Josh Braziel. He is the CEO of Rural Health Network of Oklahoma, a nonprofit consortium made up of 23 Oklahoma healthcare organizations. Josh's experience includes 18 years of rural public service leadership and 20 years in information technology and information systems. He has been involved in infrastructure planning and implementation projects ranging from the Department of Justice, multiple issues and things around HRSA, FCC, and USD telehealth grants. In addition to his duties at Rural Health Network of Oklahoma, Josh currently serves on the board of directors for the Telehealth Alliance of Oklahoma, the Remote Area Medical of Oklahoma, and has previously served on the Institutional Council of the American Telemedicine Association. Well, Josh, that's a mouthful, but how are you doing today?
I'm doing very well. How about you, Theo?
I'm wonderful. I'm wonderful. So I wanted to bring you in on this podcast today to talk a little bit about rural healthcare, right? The stats are interesting right now. Over 100 rural hospitals have closed over the past decade, and nearly 700 additional rural hospitals, which is over 30% of all rural hospitals in the country, are at risk of closing in the near future. So talk to me about, why is healthcare in rural communities so important? What are you seeing now? What's happening in rural communities?
That's a topic we end up discussing several times a week. Different rural communities. This week it came up in Stroud, Stratford, Hugo, Oklahoma. I was having talks with folks about that exact same topic. And there's a whole, I was going to say there's a system. Every system is built to funnel everything upstream. A rural place like Oklahoma, our economy, all our services, they're funneled to the big city or out of state. So everywhere policy's made, all the decisions and the thought centers, we don't make the decision process. So
Mhm.
every bit of everything is designed to funnel there. And it's almost like there's a mindset that if you want quality health care or access, you move to a city because that's where it is. But factually, there aren't that many cities. Everyone doesn't want to be there. Even if there were, there's still going to be folks working the land, out hunting, recreation. If you have a catastrophic accident up in the hills of Pushmataha County, a heart attack, you can't wait 3 hours for transportation to show up and 4 more to get to the heart hospital in Tulsa, Oklahoma City. There needs to be local and rural health care. I do a lot of telemedicine. That helps a lot. It's great for access, but I need that ER. I'm not going to get my tablet out and find the right specialist if I'm unconscious or injured a long way from town. Anyway, I could get on a soapbox and go on there forever. I'll let you talk some though, since it's your show.
Well, when I looked at the data, right, it looks like landmass of America, roughly 90% of all land in continental United States is rural areas. And it's still estimated around 60 million people, or 1 in 5, typically live in these rural communities. And so it's kind of like, why is this vast population of individuals, when it comes to healthcare, which is vital, is getting left behind, right? I know there have been talks about innovation, like maybe working with Dollar General or other, small retailers in rural communities to provide healthcare. But unfortunately, a lot of those got shuttered, right? And I'm wondering, obviously, with the closure of these large, healthcare systems in rural communities, we're saying telehealth is a potential option. Matter of fact, that's kind of how telehealth evolved, right? The need for communities to have access to healthcare. So because of the distances, they wanted to provide telehealth options, and that propagated throughout recently because of the need for, access to care in cities. But I'm just curious, as you've been in this area for such a long time, what are you seeing that could potentially work when you kind of think about the problems that's faced with it? Telehealth is a solution, partnering. What are your thoughts around how can we help communities that really are in bad shape right now?
I wish I had a real magic bullet. I can tell you the directions that we're going and the things that we are doing, because I think that's our path forward. So the rural hospitals, they're in a pinch, and there's a number of factors. If you think, if we narrowed it just down to, say, like MRI, if you're in a rural area with a high poverty rate, there's a number out there, and if your payer mix looks a certain way, you can't have an MRI because CMS is going to pay a certain rate, and you have to have a mix of different payers. So if you don't have that, you don't really get to operate one. Then you're just sending all your patients to a large area where the mix allows that. There's so many things that are along those same lines. So we've got to get innovative out in rural. We got to save money however we can. And we can do a lot of that on the technical side. We can do a lot of that on the facility side. There's some advantages we have. Labor costs. I always joke that we've got plenty of parking. So if you want a positive, we got plenty of parking out in rural space. We can always meet. But the folks who are successful, surviving and thriving right now, they're doing it as a group, and they're constantly mindful of that. And the bottom line, it's a breakover point about 80, 100 beds. The whole thought process and way of doing business is it changes there. Smaller than that, you're in constant contact with folks in your consortium group, friends in the industry, and you're honestly always got a pulse on that bottom line. You want to keep your facility open. And there's a double-edged sword in rural healthcare. So you have that hospital there. It's hard to find a MD or DO to come out and practice in a very rural area. And that next generation, it's going to be even tougher. So there's a whole loop there. The doctor needs to be able to send their patient somewhere. They can make that local. That's a positive too, but it sets you up on the next round. If your hospital isn't in existence, you're going to have a harder time attracting those folks. And talking about a very rural community, especially one with those same compounding problem, poverty and the payer mix the way they are, then it makes it even more important. If you lose that facility in your rural area, and there have been a number of reasons, even when the big systems come in, or especially when the larger systems come in, they fly that banner, try and do rural healthcare with an urban mindset, and a lot of times even that doesn't work out. Then the community's left to decide if they're going to shutter that hospital or try it again on their own when the larger system leaves. So you do lose that facility. Of course, it's an impact to the healthcare you can deliver, but you're pushing the cycle even farther down the poverty track, because rural community hospitals a big and important employer, economic driver for the town and the region, really.
And so that's the other side of the coin of the data, right? We talked about, hey, these are areas where you could try innovation and get outcomes, but then there's that data requirement. And to your point, they just don't have the resources to collect all the data as required. It was a big push. Remember when EMRs first got pushed out, meaningful use, right? And we worked with a lot of providers trying to understand, like, how can they understand how to use their EHRs more effectively and get the data. They just didn't have the cycles and time to do all that, right? And so that's where the EMRs had to kind of pull that data and help them with that. They brought in consultants to kind of guide them in that path. So similar sounds like in rural healthcare, right? Where you're trying to figure out how to make that a little simpler for them. Even in the things that we do, practices, whether they're specialty or primary care, they just have very little time, right? And so all these different mandates and solutions and technology, it has to be bolted with services, right? It can't just be, here's some technology, good luck with it. Here's some AI widget, right? That's the big buzzword, AI. It's going to solve everything. Not necessarily, right? Because I don't know about you, I've been playing with AI. It takes a lot to even come up with the right prompts and all this stuff to even get it to a point where it's halfway useful. And even then, you're still like, this is not exactly what I want. So these are the things that I think that people have to realize, that healthcare is always going to be services that has to be backed by technology, but services leads the forefront. And so, like you said, your team coming in, helping rural health centers and other communities, figuring out how you guys come up with an action plan to meet the mandate together. So they're not just all alone, because they're just not going to do it on their own. So that makes sense. So I want to kind of pivot a little bit. Let's talk about yourself as a technologist, as a consultant. I mean, look, you were in the forefront of telehealth before anyone knew how to spell it, right? And so I would just be curious. Someone saying, hey, I was at a recent insurance conference, the AHIP, last week, and a lot of Medicare Advantage commercial plans, they said utilization went from 100% during the pandemic down to 20%, right? And so utilization for telehealth has dropped tremendously, after, people are going back, seeing the doctor in person, and we're still running into the same issues, right? The staff is just overburdened. People are missing appointments. It's just the same kind of workflow. From a consultant standpoint, what are you seeing are some best practices to have a successful telehealth program that can be useful and sustainable for the future?
These days, being cost conscious, that's a plus there. There are many more options than there ever were. You can spend a tremendous amount of money just on the technology side, but there's technology that will do the job. And if you don't go in with the world's largest spend on the front end, and I'm just talking about hardware and technology wise, I think spending in planning, getting your workflow down, doing discovery of exactly what you want to do. I mean, going through the process and planning, I think it's hugely important. Very old concept of, I'm going to put enough budget number on this and go my facility a large box of telemedicine, and bang, we're going to drop it in, so telemedicine's going to work. That's far from true. You can't run the programs that way, and a lot of them were in the beginning. And I've seen lots of closets and basements full of very expensive telemed hardware. So
yeah, I think you brought me in a few here and there.
I've shown you some of those. They're out there, and the facilities, universities, and grantees who don't advertise that, they've got them too. I've seen them and borrowed parts back and forth. That's built into that business. So I think if you have an eye on the bottom line and a good plan going into it, showing ROI over time and the tangible financial and service deliverable benefit to what you're doing, that's a successful telemed program to me. And I think any common sense management group, even docs, even folks that are skeptical, when you can lay it out in a simple way with a good plan and show your improvements, to me, that's the key to success.
I love it. So basically going in with a clear understanding of the business case and what ROI you want to achieve, understanding the technology implementation pieces of it, and then last but not least, having a way to continually improve the process over time. So ROI, understanding the infrastructure, and then finally getting the continuous improvement. Those three steps, it sounds like, could really benefit anybody's telehealth program, right? Where you're in rural healthcare or in urban centers, as you look to kind of continue to scale this out. Because we see the benefits, patients want dual options, right? And we're going to see more and more of that. One of the things, just reading on stuff, home dialysis is becoming more important. We're talking about GLP-1s, right? All the, people getting weight loss drugs, trying to deliver to people's homes. Obviously, what we do, remote patient monitoring. So I think telehealth care at home is still going to be vitally important. And so I think putting together structure and infrastructure in place to kind of handle that is key for everybody. Now, this has been great conversation, Josh. Where can everyone reach you if they have questions about just, hey, I have a telehealth program. I don't know where to start. With your expertise, can you help me? Where can they reach you or find you and all that?
So email me, Josh at rhnok.org. I know this perfectly neutral Midwestern accent can throw folks sometimes, so it's the acronym for Rural Health Network of Oklahoma, rhnok.org. I'm not a social media animal, I think probably from my time in working with those folks in technology, but I do answer email like someone older than me, so I'm good there, and that's a good main channel of contact.
I'm so pleased today to have Dr. Jayne Morgan on the podcast today to discuss women's health, specifically around heart health. Dr. Morgan, how are you today?
Good morning, Theo, or good afternoon. I guess we made it. It's 12 noon.
That's wonderful. For you guys, those that don't know, Dr. Jayne Morgan is an accomplished cardiologist and the executive director of health and community education at the Piedmont Healthcare Corporation, located in Atlanta, Georgia. She plays a pivotal role in addressing health literacy and disseminating information both within the organization, which employs 47,000 individuals, and to external stakeholders. She has been involved in extensive background in clinical trials and cardiac research. Dr. Morgan has made significant contributions to patient care and medical advancement throughout her career. Her expertise encompasses not only the assessment and treatment of various cardiac conditions, including heart diseases, arrhythmias, and heart failure, but she's also highly regarded for her exceptional skills in the interpretation of complex medical data. So we're so pleased to have you today, Dr. Morgan. What are your thoughts about home health, right? Providing technology, maybe a blood pressure cuff that you receive data from, or just having someone that can visit the patient at home and coordinating that. What are your thoughts about those innovations, right? A part of that coordinated care when you look at the patient and especially pregnant women?
Love it. I'm a big advocate of it, and we need more of it. And I'm starting to see different groups starting to pull that together. But I think that is so important, especially for rural communities that may live more than an hour from a medical facility. It may not be feasible to have multiple visits back and forth. I'm a big advocate for moving some of this care at home, either digital or an in-person support visit to the house, and making certain that these patients are doing fine.
I love it. I love it. And I think that's key, right? Technology and utilizing it to the effect that can impact patient care is so important. Another innovation in technology now,
Yeah, I was
definitely.
saying it's really important. And one of the things that's really important is to make sure we can manage and monitor your blood pressure at home. Blood pressure is going to be a really key indicator, not only of recovery, but future disease and future risk, and where you are and what that management. That's why a cardiologist is really essential, to make certain that you understand what those risk factors are and you're managing it. Blood pressure control is going to be essential. So monitoring it either with an app or via some digital device, or I'm okay with someone coming to your house with an old-fashioned blood pressure cuff and just insufflating, pump, pump, however we need to get it. I think that's fine, but blood pressure is key. And as we move more and more into how are we going to manage blood pressure? How is it going to be socialized and made available to the masses? These are all questions that we have to begin to answer. And maternal mortality is one of these issues that needs to be resolved. And managing blood pressure remotely, and giving the patient the ownership and empowerment to manage it is going to be key.
I love it. I love it. I recently had the opportunity to go to the American Health Insurance Conference, national conference, where they had all the payers right across the country talking about the importance of understanding hypertension. It's such an indication of a lot of other chronic conditions.
There
And if we
is.
can manage that nationwide, right, and get those numbers under control, uncontrollable hypertension is getting out of control, especially when we had a pause during the pandemic. And so now this is an opportunity to get back into this area of understanding how we can get hypertension under control. And we talked to a lot of payers as well. It's such an important factor that part one of the HEDIS measurements is uncontrollable hypertension. And
That's
so
right.
weighted indicator that to help them meet certain qualifications to meet HEDIS measurements. And so I think payers understand the importance of it. The government understands the importance of it. You as a provider,
Right.
a clinician understand the importance of it.
Right.
So the
Yeah,
goal
as a
has to be
cardiologist. And Theo, you are absolutely correct because it's not only the blood pressure that is poorly controlled, it's the unidentified blood pressure. It's people who have high blood pressure, and we estimate that it's more than 50% of the population. I know we're a little bit off of maternal mortality, but let's just talk about hypertension for a second. It's estimated that 50% of the population has unidentified hypertension. So they don't even know they have it. So therefore, it can't be treated. And listen, you can only treat 100% of what you diagnose. Like we can't treat something we haven't diagnosed yet. And so there's all that opportunity out there as well. Then the last thing I'll say about maternal mortality is that there's something called maternal morbidity as well. The female actually doesn't die. She recovers, but long term, we now know that female, that mother, has an increased risk of heart disease, especially as she enters perimenopause and menopause years, and her estrogen levels begin to decrease. And those estrogen levels that are protecting the heart during all of our younger years, when you get into midlife, those estrogen levels start to decrease. That is an incredibly challenging, difficult, and risky time for someone who actually has not had maternal mortality. Thank goodness. It was a save, had maternal morbidity, had complications, survived them, but long term has higher risk and absolutely needs to be monitored even more closely as she enters into perimenopause and menopause. And that can be as early as 35 years of age. So just
hmm,
because you're still having menstrual cycles and they're still regular, you still may be entering into menopause, perimenopause between 35 and 45 years of age. So you've got to have these discussions with your physician as well. Your obstetrical history is important for the rest of your life. No matter what doctor you go to, if that doctor is not asking you your obstetric history, as she or he turns to leave the room, you can say, "Excuse me, doctor, would you like to know my obstetrical history?" And then you need to volunteer that because that history will let the doctor know what your risk is or isn't of heart disease regarding just your pregnancy history can give us a window into that. So make certain that if you're not asked, you volunteer that information at every single physician's visit, that you let them know what your obstetric history is. Even if it was normal, that needs to be noted in your charts.
I love it. I love it. And definitely, and a lot of the providers that we talk to always ask your patient and taking that moment of time to have those conversations with your patients
Right.
around this because it's so critical to your point. One thing I do want to talk about, we talked about innovation and just technology delivering to patients, but one of the great technology innovations is social media. And as a clinician yourself, I think you've taken advantage of it with, if you haven't seen her great Stairwell Chronicles during COVID and just communicating your expertise. Why is that so important now for experts like yourself to be out there
Right.
on social media and communicate the truth around healthcare and innovations and how patients can be more of an advocate for themselves? And so, what are your thoughts around leveraging social media as
And in full transparency, I backed into it. I was on social media platforms before COVID, but was using them for social things, right? Who's getting married? Here's some photos. Let's have fun. Where's the party? And then during COVID, I was named as the executive director of the COVID task force for the Piedmont healthcare system. And I just want to say something about Piedmont. We are the largest healthcare system in the state of Georgia, 47,000 employees, 23 medical campuses. We are huge. And in leading that COVID task force, it became rapidly apparent to me that, especially by the time we hit that second wave, that misinformation was going to be the biggest challenge. And that's how I started the Stairwell Chronicles. So the Stairwell Chronicles is a series where I literally sit on the steps of my house. That's my house. Those are my stairs. I'm wearing my clothes. And I literally talk with you. It started out just COVID, things about the vaccine, but in a very short, abbreviated way. Each one is only about 60 seconds long. It's just 1 minute. You listen to me, I ask a question, I answer it in 60 seconds or less in a very easy to understand format, like your sister, your aunt, your hairdresser, your neighbor. We're just having a conversation. And I give you that information. It started with COVID, but developed a cult following and was fairly effective. People tended to like that conversational format and the brevity, I think, to be honest. And it now, on this side of COVID, I've gone back to my roots. I talk a lot about heart disease, and then my passion, women's health, and my background, clinical research. So I talk about all of those things. And then if you ever see me on news media, I talk about a plethora of other topics as well. So those will be on my social media. But if you come to my social media, I'm really talking about medicine and giving you information all the time. And you can choose to internalize it or not internalize it. It's just something, I don't make you do anything with it. I just put it out there and you can make a decision about it. And I'm happy to interact with you in the comments. So there you go.
I love it. I love it. And I think more clinicians need to realize the power of social media and the impact it can have for individuals, any patients, other providers, to give them the latest and greatest information in sound bites they can do better research on later and be more informed. And so we have a lot of voices out there now in social media that don't have the background that a lot of the providers have, right?
That's a good point. You be careful who you're listening to. They may or may not have the background, regardless of what they're calling
Exactly.
themselves, and regardless
Exactly.
of what they're talking about. They actually may not be the real deal. So make sure you're following the real deal. Right.
Exactly. Exactly. Dr. Morgan, this has been a great time, great informative insightfulness, definitely around, maternal health and the future and how we can help impact that. Where can
Yeah.
people find you? What's the latest that you have that you're working on? Let the people know.
Thanks, Theo. Listen, everybody, you can follow me. I'm on all the social media. I'm on Instagram at Dr.Jayne Morgan. It's DrJayne. That Y is in there. That's the number one thing that people miss. So it's DrJayneMorgan. Dr. Jayne Morgan. I'm on Instagram. You can find me on TikTok, on X, on Threads. And on LinkedIn, I'm Jayne Morgan, MD, JayneMorgan, MD. I would say Instagram is probably where I do the most, and I might post some personal things from time to time there as well. So it's maybe a little bit more lens to creativity, but please follow me on whatever platform you wish. My next thing, my next chapter is really continuing the focus on menopause, on women's health, on health equity, on research, and then also really doing a drill down deep dive into hypertension and how hypertension actually interconnects all of these to end up with that excessive cardiac mortality. So more to come. You'll hear more and more from me about high blood pressure and why it's important for everything, for women's health, for menopause, for maternal mortality, for clinical research, for women's health, for health equity. It's going to be the tie that binds us all together, and you'll hear more and more about it.
I'm back again with another great medical innovator. I'm here with Dr. Emmanuel Isang, and we're going to go into details around hypertension and heart health and how it can help you grow not only your medical practice, but help your patients get better for the future. So, Dr. Isang, welcome to the podcast today.
Thank you. How are you doing?
I'm doing wonderful. So if you don't know Dr. Emmanuel Isang, he's doing a wonderful work out there on the internet and Instagram. He's over 7,000 Instagram followers. He's on YouTube, around 3,500 subscribers. He does a great work about communicating the value of health, as well as helping you guide your patients through the journey of just taking care of themselves and explaining difficult topics around heart health. Dr. Isang, anything else you'd like everyone to know about you and your background?
Yeah, for most of the people who don't know, Dr. Isang, I was originally born in Nigeria and moved to America when I was 6 years old. And my dream, probably when I was around 14, 15, was to end up playing football in the NFL. And that came, to a tragic end in 2001 with a leg injury. And ever since then, it was my dream to always be able to help people because of the orthopedic surgeon who helped me. So from there, I kind of knew I wanted to be a doctor, and it took a few more years to realize which type of doctor that I wanted to be. And I was grateful to be able to come back to my home program to complete my cardiology internal medicine residency and then cardiology fellowship. And now I've been out practicing for 2 years now. So I'm super excited. And to kind of summarize it, as prevention is the most important thing that we can do for our patients and for ourselves, and just understanding that prevention is a lot cheaper, a lot better, financially healthier than treatment. So if there's one thing that I want people to know me for, is the importance of just preventing heart disease itself.
I love it. I love it. Like we talked about, you're out there in social media, massive following. Do you feel like doctors should be on social media? Is that part of that outreach strategy in your mind, make patients aware of how to take care of their health?
Yeah, I think doctors should at least consider it. Social media is not for everybody, and it's very complex too. So in one sense, you probably can and not even have to show your face, because I think the biggest fear is imposter syndrome. That's one of my biggest fears too, is how I look in front of other people. And there are just some people who don't want to utilize social media in that aspect, but they can create content that just provides educational resources. So in one way or another, we should do a better job, because I see brand new patients 30 minutes and returning patients 15 minutes. With social media, with a post, I can reach viral posts 1 million people. So you can touch the lives of so many different people within 10 to 15 seconds via social media. So I think in one way or another, we should be utilizing it more. There are going to be some people who want to be the face of the social media. Some people just want to be the text, but in one way or another, we should be utilizing it more and just trying to educate people, because as much as I'm telling people to exercise and watch what you're eating and don't smoke, you have the tobacco industry that's pushing something else. You have the fast food industry that's pushing something else. So the only way that we can fight is just to push as much, if not even more than they are.
We tell our doctors that we work with, it's imperative to kind of get your message out there, not just for awareness, but also branding, and also to help you communicate, some of your insights and utilize these platforms, right? They're free, right? But to your point, because they're free, they're not easy, right? And being consistent to utilize it. Just curious, what made you start down this path to get into social media? What was your impetus? I talk to a lot of doctors all the time, and a lot of them, they just feel like they have no time, right? They got to see patients. They're independent. They have to run their practices. What made you flip the script and say, hey, I'm just going to be dedicated to making this something that's part of who I am?
It was one of those things where people were asking me the same questions over and over. What's causing my palpitations? What's a good blood pressure number? I think the biggest one is, people love the word reverse. How can I reverse heart disease? So instead of answering 20 million people the same question, why not create content that you can just say, hey, go look at this. I've talked about this extensively, and this is what you need to look out for.
I love it. And how's that help with just exposure? Do you feel like that's helping you get your message out, but also expose you to new opportunities that you didn't see happen before by being on social media?
I think absolutely. I think one of the best cases is this one person that I met on social media. She goes out of her way to message me at least once a year, because she had actually had high blood pressure. Nobody could figure out why, but she was just being okay with it. I think I made a post about other potential causes of high blood pressure, to look at the kidney arteries, look at the adrenals, look at hormones, and she actually did it and actually had a blockage in her kidney artery that ended up putting in a stent and opening it up. And basically she went from being on 4 medications for high blood pressure to just being on 1. So the message is heard. And I think over the years, I think I really went hard in 2019, now in 2022. So it's been a couple of years, and it opens up to new opportunities such as this one too, which I was very excited, because I've been doing the same thing consistently for the past few years. And I've always been thinking about, what can I do next? How can I provide more care, or how can I expose these health conditions more? And the more you post, the more you're present, the more opportunities that you're given.
How much time do you feel like it takes out of your day, or your week? Are you spending like an hour at a time? a week to kind of get this out? Do you have a team? If you're talking to like your colleague and saying, hey, how do I start with social media?
It's a team of one right now. And I think that's where I'm going to need to pivot eventually, because it becomes a lot. But it's also easy because one of the things that I have is a book of just topics. And whenever I get an inspiration, I just write it down. Or if I see someone who's made a message one way, I'll flip it to something cardiac or health related. So I probably utilize about 45 minutes a day on it. I'm trying to be able to scale that down more. I think the best way to be able to do it is just put out a time where I can just do everything all at once and then schedule the post to be made automatically. But I'm not in that phase yet. I should be, but I just haven't pulled the trigger yet.
Yeah, definitely. I mean, consistency is key. We saw explosion of doctor influencers, right, during the pandemic. And that was helpful, right, because it was an unknown time and something that we've never seen before, worldwide pandemic. I've seen some doctors take a step back a little bit from that, but now is even more important because a lot of these other voices, right, that are not medically trained, right, are speaking out and giving their opinions. And we saw during the pandemic, a lot of misinformation went out there. And so I'm encouraging other doctors, and we do help them also with social media as well, because that is so key to get your name out there, communicate and bring value. And to your point, just a hesitation, even I was hesitation. I started just 2 years ago. I'm not a medical doctor, but I'm a business person, but it's always that first step to do it. Once you get used to it, to your point, I got all these ideas, I can put them out and ways to communicate the value out there. And I think that's so important.
One of the things that I found, or the setbacks or the roadblocks, is my own thoughts. I think I'm not going to post this. I'm not the right authority figure for it. But then when I post something about something similar and then somebody gets good knowledge from it, they'll message me. It's like, thank you for posting this. I've sent this to my husband for him to go get looked. So I feel like what I feel about what other people feel about me is what I internally feel about myself. So I need to just get over that hurdle and just press record.
Everyone has their own perception of reality, but it's really not reality, right? It's just what your perception is. And so to your point, you just get over that and just do it. Like I said, I've gotten flamed before on the internet, and I told my team, don't worry about it. It is what it is. And we'll just keep moving. So you just put the information out there and try to help as many people as you can with a good intention and heart, also work out. So yeah, that's great advice, definitely, for a lot of medical professionals that I talk to, and the importance of doing it. Because I think this is the new way of just communicating with people now. I grew up in a generation where you just talk to people one-on-one, had conversations. But now, even I notice myself, I'll watch someone's content, then I'll go down a rabbit hole and I say, why he's good. And eventually I'll come back and reach out to them, right? It may have been like months later. All that time I've been listening to their philosophies, their understandings. And I said, a lot of stuff he's talking about, something I agree with, just like that young lady you mentioned. I bet she was probably following you for months or weeks before she actually reached out, right? And then
absolutely,
you have helped her so much that now she's reaching out every so often. I mean, you're almost like a trusted advisor at that point. So I think that's really important. So let's talk about the connection of healthcare, and you talk about physical health. You were a football player. When you kind of talk about that, the younger generation are just doing outreach. What are some of the key things that doctors can tell their patients to stay healthy around their heart? Obviously, there's the standard 30 minutes of walking and eating healthy. But are there three simple things that doctors can just take every time, whether they're primary care or, a specialist? What are the things you feel like are easy for people to assimilate and do?
People are unhealthy for several reasons, or there are several things that they're putting into their bodies that's leading to them not being healthy. They're eating excess calories, they're drinking excess alcohol, they're smoking. So for me to tell them to just stop everything for your heart, which they should, I start to emphasize choosing one thing at a time, because it's going to be hard for them to break every single habit all at once. But if they can find one, break that, or get close to breaking that, and then get into the next. And even with nutrition, if they're having those late night snacks, you just got to cut it out or switch to something else, more protein and less processed. Just finding one thing that they can do to get the results that they want, but also understanding that it didn't take one day for you to be in horrible shape. It took consistency in making the wrong choices. And with that, you're going to need the same consistency in making the right choices. I was the biggest example for my own self, because I was trying to lose weight and I would put in 30 minutes to sometimes even an hour but I would only do that one every 2 weeks. And I was just burning myself out trying to lose weight in a short period of time. But I put myself in the test saying that I was only going to work out for 15 minutes every single day, but I would do it every single day. And when I did that, in a span of about 6 to 7 months, I lost 20 pounds. That was my goal. I didn't want to lose that much weight because I didn't need to, but I wanted to show myself that it's possible. You know, the guidelines are 30 minutes, but if you can only allocate 15 minutes, that's pretty much all what you need. That with just monitoring what you're eating and monitoring when you're eating. A lot of people are having a snack and then an hour later having a snack and then an hour later having another snack. Yes, it's not that many calories, but you're spiking up your insulin levels, which is good for removing the glucose out of the body, but does have detrimental aspects in regards to calcium buildup, plaque buildup, and heart disease. So just understanding those small steps and being consistent can make big changes, but you have to give yourself time.
Yeah. There's research in that area where they talk about like building a habit and staying consistent. And like you said, those small things that you can do every day. And then I'd play tricks on myself. I try to do push-ups every day. It's one day, that's it, not 2 days in a row. So I try to be consistent with that every day. You know, to your point, it does build a sense of stableness, but also, like you said, I see more strength. I can do more. I can only do maybe 40 at a time. Now I'm doing way more now. So I'm like, hey, listen, I've been doing it for about 3 months, pretty consistent. So I agree. I think that's the key to consistency to that factor. Like you mentioned, you were a football player. I played basketball. You did your 2-a-days, right? When you were younger and went all out. And I was doing my suicides back then. It was a lot easier. But yeah, as you get older, trying to figure out those consistencies. And if you don't have 15 minutes, then you don't have a life. So you can do 15 minutes. So I like that aspect of it. So when you do speaking engagements or you go out and outreach, what are some activities you see that work well when you're trying to reach out to the populace to talk to them? Outside of, social media helps, but like when you're in your area there in Tennessee, how are you kind of reaching out to individuals to talk about these things?
Usually we'll have an event, but I think the event that works the best or the way that people are engaged the best is just an open-ended conversation where I find one topic and we talk about hypertension and kidney disease. But I only talk about that for like maybe 5 to 10 minutes, but the event is open for 30 minutes to an hour. So people are just, whatever questions is bothering them, and sometimes goes out of the scope of the point of the talk, but still giving people just the opportunity to ask any questions and all questions possible. I do find that when we have events, the ones that people show up the most is the ones that you're being able to, you have to give them a freebie. So the freebie is free glucose scanning or checking the blood pressure. And when you utilize that, you give them what they want to be able to provide them what they need.
Yeah. And I think that's marketing 101. You definitely have to give people something, help them before you help them, kind of in a sense, right? Hey, here's something free to help you, check your blood pressure or your glucose. Oh, by the way, there's more help here that you can get as you kind of enter into that. So we see that a lot as well. When you think about the future of some of the innovations that are happening in technology, what are you most excited about when it comes to like cardiovascular health? There's preventive things that we can do. But when you look at medicine and where it's going, not just with medications, if you want to talk about that, or technology itself, like I mentioned, we do a lot with remote blood pressure monitoring. We both were sports guys. People don't pay attention unless you keep score. Blood pressure, people are checking the blood pressure every day. So, oh man, it dip down, what I need to do, So what are your thoughts about like innovation and technology and how that can help change the tide toward better heart health?
I think the best way to answer that is with a patient that I just had. So I was seeing her for the past 3 months she was having abnormal heart palpitations, skip beats, and we couldn't figure it out. So I put her for a heart monitor for 7 days. I couldn't capture it. So I felt good that I was going to capture it in 30 days. Still couldn't capture it. And I remembered that I have a device called a CardioMobile, which is basically an EKG that you have at home. It's about this big and you put your fingers down on it and it'll give you an EKG at that time. And I think within 2 months of her buying that, she was having the symptoms again. Thankfully, she was awake. And then we were able to find the abnormal heart rhythm that she had called SVT. From that, I was able to send her to one of my partners who does an ablation to basically potentially get rid of it permanently. So if it wasn't for her getting that CardioMobile, we probably would have never been able to diagnose what her symptoms, what her issues were. So it's pretty awesome that, in the past, to be able to get an EKG, you had to come to the hospital, they had to put all these electrodes on you. It was frustrating. They would leave some on you and you would find them when you were taking showers. But now at home, you can basically get your own EKG. You can actually save it and you can send it to your doctor and they can make medical decisions based on that.
Yeah, we're seeing obviously the advent of artificial intelligence become more relevant. And so it's still early days, clinical decisions with it, but in certain cases, looking at data sets, radiology is being able to find things better than a radiologist, right? And so to your point, the data, capturing it at where the patient lives, and then being able to kind of utilize the data to find trends can really help be an assist to the doctor. So I could definitely see technology with artificial intelligence embedded, assisting you in making those decisions faster, right? And saying, hey, based on the data, because from my understanding, you guys do a lot of case study work in medical school, right? So your percentage of a 75-year-old man who has this type of condition, he's going to have X. Right, based on statistics, right? And so that's what artificial intelligence can do to kind of help accelerate that. So we're seeing more of that.
There's some softwares that are tracking your age, risk factors, and your EKG. And from that EKG, they can predict if you're going to have heart disease in the future.
So definitely, these are some of the great things that are happening. So this is great, Dr. Isang. I think this is insightful for how to communicate these type of things for patients, but also for doctors themselves to kind of take to heart. And we talked to a lot of medical practices, and this is kind of what this podcast is really about, to educate them on ways to communicate to their patients, but also to put themselves out there with their expertise. So what's next for you? What do you have out there, or anything you want to communicate and promote?
Nothing yet. I think eventually, what better way to help people, especially people of color who look like me, than to tell my story in the form of a book, the obstacles going through from football to football injury to becoming a doctor. So that's one of the things that I want to do eventually hopefully within the next year. Like I mentioned before, I think 2 or 3 years ago, I wrote an ebook to just kind of help people with the 7 most common questions people ask me regarding high blood pressure, palpitations, chest pain, heart disease, and prevention. But the biggest one is just educating people on all platforms.
I love it. Yeah, definitely. If you have it, send us a link and we'll put it in the show notes so people can get a copy of that for their own usage. Dr. Isang, thank you for your time. Appreciate it, everyone. Thank you for listening to the latest podcast on how you can talk to your patients more, help you grow your medical practice, and understand the latest innovations and technologies and ways to communicate out there in the new health normal. So what's going on in healthcare. So thank you for your time, sir. You have a great one.
Absolutely. Thank you.